So, Dr. Rafael Gonzales,
Pleasure.
thank you for really being down here in Costa Rica with us and bringing
Thank you.
your tremendous years of experimentation and future thought in this whole field of stem cells and aging in general. And one of the reasons we wanted to have you come down here is talk about a whole new approach to stimulating our immune function, keeping our immune function as heightened as possible, particularly in today's environment with multiple viral type infections, bacterial infections,
Yeah.
but also how some of these newer technologies that you've been a pioneer in are actually helping with the aging process at the same time as enhancing our immune function, removing viral infections. Some things we haven't had treatment options for, like Epstein-Barr virus. Let me do it again. So some things like we've never even had treatment options for, like Epstein-Barr virus, which is a very, very common infection globally. So, I was fascinated by your research because its applications to aging, but once I heard more about it, there's much more than aging as far as a target for this new technology. So tell me a little bit about NK cells.
Yeah, first and foremost, my focus and one of the biggest focuses, of course, is the immune system.
Right.
Focusing on looking at the immune system and what we can do, because every single disease we know is an immune component to it, and it causes havoc, nightmares, and a mess. And as we age, we're exposed to a crazy amount of different things that are just hitting us from everywhere. You know this, all these different angles, the environment, viruses, COVID, this, that, bacterial infection.
Artificial materials.
Artificial material, food, exactly, diet, which is one of the biggest, really, really large issue there.
Right.
So focusing on many different aspects, because all of this, when we discuss the concept of aging, causes a premature aging, which premature aging in general leads to one big word, which we all know great, is senescence.
So would you call it premature or accelerated?
Accelerated due to all the different factors that we're dealing with and all the different changes that are transpiring on a daily basis that we have to deal with. So it is accelerated aging, and it causes senescence. Now, when we discuss the context of senescence, there's many, many different things that cause it, but we discuss things that you work on, particularly like senolytics. And in particular, my big focus is cell therapeutics in general, working with cells and finding cells that actually do this. And one of the key cells that we work with are natural killer cells, a simple part of our innate immune response, our immediate responder to viruses, mutagenic cells, and senescent cells.
Right.
And when we look at NK cells, these unfortunately age as we age. That's why the older we are, the more prone we are to get cancer, these type of things. But we've done a significant amount of research now that we can actually obtain NK cells from you. We can actually take them from you. We can actually activate them and make these things now true natural killer cells again,
So
like when we were younger.
I got to stop you because this is a perfect example of what some of our technologies are doing. Is if you're taking these old NK cells that are not functioning, they're not able to keep us safe, our immune function optimal to get rid of bacteria, viruses, and even cancer cells, and you're able to reboot them, aren't you really reversing the aging process in NK cells, restoring them to a more youthful, functional state, perhaps even better than they originally were?
Correct. Yeah, we are growing them up, proliferating them, activating them to a younger state, putting them back in there. We're making them the natural killers they were when we were young.
So your data, you've treated a large number of patients.
Yes.
So has your data shown, for instance, is there a marker that you can measure from blood that actually says, gee, your senescent cells are getting more and more active or more in number? And is there a data that shows after you do a treatment that you can actually lower these, if you will, biomarkers?
Yeah, some of the constant, one of the more common markers that we looked at is the beta-gal senescence, which is a specific marker, it's a specific enzyme that sits on the outside of a senescent cell. Right. It's the most common form marker that you actually look at when you look at senescent and senescent cells. That's one. And two, we look at cell cycle checkpoint inhibitor, which is P16. Yeah, so P16 essentially when we treat patients, and we're going to eliminate senescence, what you're actually going to cause is cells now to be able to proliferate. When cells are proliferating, P16 is downregulated, so it's reduced. Right. So what we look at are those particular markers, and we see a significant drop in immunosenescence, so meaning senescence of immune cells when we test blood.
So normally, as we age, and we are all aging in an accelerated fashion, faster than we actually should or could, the same thing's happening to our immune system. And in the old days, when people died on their death certificate, they said natural causes. So the natural causes were really partially due to a drop in our immune system ability, our NK cells, to keep us healthy. So today we know there are natural causes.
Yep.
It's cellular, if you will, it's a decrease in cellular function of, well, for instance, NK cells come from hematopoietic stem cells.
Correct.
And we collect hematopoietic stem cells here, store them, and particularly if we collect them with young people, they're getting their NK cells at their optimal level.
At a younger state.
So 30, 40 years down the road, while we've kept these cells in deep freeze and they're not aging, we can give those cells back to somebody who's in their 50s and literally give them back an immune system they had when they were in their 20s.
Correct. Not only that, you are essentially paralyzing time, offering what we sort of call like a bioinsurance, because technology increases significantly. Right. And at some point in aspect, I mean, we're consistently learning, we're learning how to do new things. Right. And if you're able to take those cells when they're good, they're relatively healthy, right, and take them and possibly at some point later on when disease occurs, right, basically amplify them, grow them, purify them in even larger numbers than we can now. Because based on, for instance, some of the data that we actually obtain from about 20 million cells, we can actually proliferate up to billions of cells, a couple billion cells. Right. But that technology 5-10 years down the line that you've held now, can be 20, 30, 40 billion cells possibly as we learn, because this is science and we're learning more and more how to do this.
So what you're saying is if we find out that this is capable to collect and store your cells at a young age, this would be the ideal time to do that when you're young. And later on, even with existing technologies we have today, we could literally take those really healthy cells, and create greater numbers than we can even do now if we do it with older people.
Correct, 100%.
So basically a super immune system.
Yep. Yeah, and you can actually put that back into somebody that in the ideal situation will revert the immune system back to a younger state. We'll keep that person healthy. We'll be able to have a healthy immune system that as we age, we know we get sick a lot more often. We have a lot of other issues, and the immune system causes neurodegenerative diseases, right. Causes heart diseases, causes a bunch of other issues that are age-related and age-associated diseases. With this type of what I call, like I said, a bioinsurance, we're buying time.
So the name of your company that does all this research is what?
ReStem.
ReStem.
Yes.
And you're located where?
We're located in California, in Southern California, and have been in existence for a long time. We've been doing research study for about 13 years now, looking at essentially first stem cells, a particular stem cell that we study, which is from the umbilical cord. We have a patented technology on it. And then secondarily to that, we got very interested with cell therapies in general and looking at senescence, aging, and working with natural killer cells.
So let me go back to the natural killer cell, the potential for those. Right now, what diseases can NK cell therapy really make a big impact, particularly diseases that we really haven't been able to have a definitive treatment for? And I know, for instance, Epstein-Barr virus, which is a big precursor to potential cancer, is one. Lyme disease, fibromyalgia, general immune decline. These are the type of things that NK cell can make a difference in.
Absolutely, and possibly things such as chronic fatigue syndrome, looking at that. Essentially, when we look at the literature and we look at the amount of clinical studies that are available out there, everything is focused on targeting cancer because, as the cell is called, it's a natural killer cell. It's naturally designed to kill a mutagenic cell, it's naturally designed to kill a viral cell, and it's naturally designed to kill lastly, the senescent cells.
So have you had clinical experience with people who've had some of these diseases who you're able to measure the difference in, say, Epstein-Barr virus titer, or?
Absolutely, yes. So we can essentially, using natural killer cells, we can reduce, because the cell is designed to do that, is to, if somebody has a high Epstein-Barr viral titer, we can actually reduce that significantly. And we can look at other viruses in general too, using natural killer cells. We can actually reduce viral titers with various different viruses also.
This is going to open a whole new potential treatment gateway for people who've been suffering from these diseases, and now we're going to have an option to do that. But at the moment, is NK cell therapy legal to give in the U.S.?
No, it's not, because of the simple fact that it's considered what they call a more than manipulated product, because we have to culture expand them from you. So when we take out a blood draw, we obtain anywhere from 5 to 15% of your white blood cell population is a natural killer cell in a relatively healthy individual. And then from there, so the numbers are relatively low.
Right.
And then from there, we have to expand, proliferate, and actually activate. The most important aspect is activate. Because the last thing I want to do is take something that wasn't working in you, grow it up, and then just put it back into you.
Right.
Yeah.
So one of the things we've talked about, here in Costa Rica, we have the potential to use NK cell therapy. In fact, this is one of the reasons why I wanted to have you here, in a legal fashion. And, laws in the U.S. are very different than laws are here. And here, we actually can give intravenous stem cells, for instance, for things that we have a large amount of inflammation for, which is one of the things that senescent cells do. And the reason that we're here is that we're looking at doing cutting edge research so that these newer technologies that are not going to be available, or not available now, but won't be available for the foreseeable future in the U.S., will have a gateway for people to come and be able to benefit from safe clinical research trials that we're doing already, and that will open the gateway for these people to live longer, healthier, and have another option as far as just staying at home and being told there's not much to do for these things.
Yeah, which is pretty common of what you hear of when people go to your normal standard doctor, that there's not much we can do for these things.
Yeah.
Not looking in a lot more detail at, like we just talked about, viral titer, looking at senescence in general.
Right.
Eventually with the senescence that transpires and having an unhealthy immune system to combat this, what we essentially get is the secondary effect that we haven't even spoken about, which is stem cell exhaustion.
Exactly. That's the big thing.
And that's another big thing that is a big problem when we discuss aging. And all of this essentially, somewhere along the line, starts what we just said, accelerated aging, causing a lot more problems, and it ends up just being where you end up having the start of a heart disease or the start of a neurodegenerative disease that just goes like this. When you normally hear somebody starts to have the problem, it's just moves so fast that it's hard to target it, look at it. When if you can target it now and you can start essentially being prepared for it, once again, I said bioinsurance, just be ready for it. You have a big start and living our big word, health span.
Well, let me ask you this. I mean, you've been here, you've actually seen our processes with collecting all three type of stem cells, which the hematopoietic, our immune function, is basically the origin of our endothelial progenitor cells, which are to maintain and grow blood vessels, and our mesenchymal stem cells that are involved in regeneration and cell repair. Now, this has been a unique philosophy and concept of mine for over a decade, and we are now able to actually collect, store, and give back those cells in a legal environment under clinically strict conditions. What's your thoughts on there are many stem cell clinics out there. How many are really looking at the importance of all three stem cell types, looking at the importance of boosting immune function, but also looking at cellular therapeutics which help maintain the function of the cells we already have, somatic body cells and stem cells, by using both medicinals and key nutraceuticals to maintain the internal environment those cells live in. So this has been, our concept.
Integrating multiple aspects is what's going to be completely required, because one thing is never going to help repair or deal with the problem. I mean, if you integrate everything, which is what you're doing, nutraceuticals, senolytics, various different cell types to target the different issues, it's the correct approach. It's the correct approach in general at integrative medicine and looking at aging medicine.
Right. Well, see, the other aspect is we've added a whole new cadre, a group, if you will, of these new tests that lets us look at the epigenetic level or the gene level, which is where aging starts. And with that, with tests that look at DNA damage, free radical levels, inflammatory markers, all of this, these are like pieces of a puzzle that have been scattered all over your table. And when you start to put these pieces together and see the impact, how they work in synergy, you start to see the picture of the aging process a little more clearly.
Yeah, and not only that, you're actually telling someone, this is what you had, and this is the change that we made. And that's what everybody wants, because essentially anybody can give something to somebody, yet if you don't show them that there's actually been an actual change, then essentially you sort of have done nothing.
Exactly.
Yeah.
It's all subjective.
Yep.
So one last question before we go. I think the work you're doing is just phenomenal. We're looking forward to working together with you and ReStem in the immediate future. Mm-hmm. But if somebody was to ask you, how much is an extra decade or two of quality health and time worth? What price would you put on that?
There is no price to health. That's my price. There is absolutely zero price to health. Right. Living, smiling, being able to do what you love to do is more important than anything out there.
No, I agree with you, and I'll finish this with a little story, and it's not about elephants or anything like that. But I had the honor to go to the Vatican and present our work on actually restoring and reprogramming old stem cells to work like young stem cells. And this was in an audience in front of all the cardinals. And one of the cardinals stood up and said to me, "Young man, why would you want everyone to live longer? We have too many older people." And I had to think of an answer that wasn't scientifically based. So being Italian and having studied the arts, I asked him, Your Holiness, if Michelangelo or Da Vinci had lived another 10 years, can you imagine what they would have given the world with their genius? And he looked at me and he said, "You have a point."
A really good point.
So what life is about is if we can live a little bit healthier, and I'm not saying necessarily longer, but the last few decades of our lives, we can be productive and utilize the experience and knowledge and contribute to society or even our own families and ourselves. That's probably one of the best gifts you can get.
Absolutely. And one of the best gifts you can give actually to your family members and to your friends is to live a long, healthy life.
I agree with you. Listen, I can't thank you enough
Pleasure.
for coming down.
Thank you very much.
Let's make forward. We stay in touch, and
absolutely.
I'm looking forward to see how ReStem's new research in NK cells will open up a gateway to multiple other diseases that many, many people in the States really have no other options with.